Hysterectomy means removal of the uterus. Heavy bleeding during the periods or between the periods, sometimes the pain or sometimes the discharge. Friends, this is Dr. Rakesh Mittal. I am a General and Laparoscopic Surgeon. Today we'll talk about the role of laparoscopy in hysterectomy. Hysterectomy means removal of the uterus. Uterus, I hope all of you know, it's the female internal organ where the fetus develops, where the newborn, where the new life develops, right? So uterus is an integral part of female reproductive organs. Now, mostly in 30s and 40s, women experience lot of bleeding. The symptoms: heavy bleeding during the periods or between the periods, sometimes the pain or sometimes the discharge, whitish discharge from below, and sometimes very rarely heaviness or pain or swelling in the lower part of the abdomen. Now, what it is due to? Mostly the condition is known as fibroids. These are basically benign tumors that develop inside the muscles of the uterus. It's a very common condition in women in their 30s and mostly in 40s, right? So what to do if you have any of these symptoms like heavy bleeding during the menstruation or intermenstrual bleeding? Immediately consult a doctor, a physician or a gynecologist or a surgeon. Get yourself examined by a female or male gynecologist or a surgeon, right? And a simple ultrasound is needed to diagnose uterine fibroids. Once the fibroids are there, initially the symptoms can be controlled with medicines, but eventually most of the patients will need surgery. That is, we have to remove the uterus. Once the purpose of uterus, that means family is complete, patient, the woman doesn't need childbirth any longer, uterus can be removed. In older times, it used to be removed by an open surgery, this big a cut in the lower abdomen. So lot of complications, severe pain after the surgery, lot of time needed for recovery. 2 weeks patient is not able to get out of the bed, right? Working women, your lifestyle is hampered, you're not able to work for 2 weeks, 3 weeks, so lot of complications. But nowadays, laparoscopy, last 20-25 years, laparoscopically has come up. Laparoscopy is a keyhole surgery with 3 or 4 very small holes, this size holes, made in the abdomen, and uterus can be removed safely, right? The definite advantage of laparoscopy is there in uterus removal, right? And the major advantage is, first of all, very small cuts, just 3 or 4 small keyholes. The other advantage is minimal pain. Patient after the surgery, patient can be discharged early after the surgery. Early recovery is seen, minimum post-operative recovery period. Patient can return or join back his or her duties very quickly after the surgery, and it's not very expensive also, so it's highly cost-effective surgery, and it's very safe, so not a significant complication rate compared to the open surgery. So if you have any uterine condition that needs hysterectomy, that is removal of the uterus, so do consult your doctor for a laparoscopic surgery. Thank you.